I want to welcome everybody to our 2023 Dairy Goat webinar series. This is our last webinar for the year. My name is Jennifer Bentley. I'm a dairy field specialist housed in Northeast Iowa, and I'm joined with my colleagues Larry Tranel, who's also a dairy field specialist in Northeast and Southeast Iowa, and my colleague Fred Hall, who's out in Northwest Iowa as a dairy field specialist as well. So they're going to be helping to facilitate our webinar here today. We do have Dr. Fauna Smith, as she's going to be talking about milk quality in dairy goats. She's an assistant professor of livestock, herd health, and reproduction at the School of Veterinary Medicine at UC Davis. And her expertise is in immunology and infectious diseases. Her research interests are in the areas of field research on novel approaches to prevention of gastrointestinal or respiratory diseases of sheep and goats, and biosurveillance of California's small ruminant populations for emerging infectious diseases. So I'm happy to have Fauna on here today. She was a guest presenter for us here in Iowa just a few weeks ago, talking about some of the same topics that we're going to be talking about here today. So glad to have you back on our presentation here, Fauna.
No worries. It's great to be able to join you guys today. I was a little conscious that I'm talking about the same topic, so I tried to actually mix it up a little bit and make some changes so that some of the people that have already heard me talk on this topic get some new information. So today we're gonna touch on milk quality, and then more specifically, we're going to talk about mastitis in goats and actually some of the research data and clinically relevant cases that we've seen in our practice here in California. So first of all, I think one of the questions we always need to answer is, what is milk quality? And really, when we're talking about milk quality, the quality of raw milk is the primary factor that determines the quality of milk products. And this doesn't matter what milk products you're making. It doesn't matter whether it's milk for fluid consumption, whether it's to go to powdered milk, whether it's for cheese production. But I think a lot of people forget about some of the other products that a lot of producers have started making, especially our kind of smaller homesteading or artisanal body product makers, that the quality of those body products is also affected by the quality of milk that you put into them. And so there are kind of 5 target areas that we look at to say, what is the quality of milk, and what high quality milk should be free of debris and sediment. It should be free of off flavors, abnormal color, or odor. It should be low in bacterial count. It should be free of chemicals, and this can include antibiotics, detergents, disinfectants, other medications that animals are given, such as dewormers and anti-inflammatories. And it should have normal composition and acidity. So we're going to talk a little bit about what those those specific things mean and how we might be able to ensure milk quality. So first, free of debris and sediment. This is really about keeping the animals that are coming into the milk parlor clean. And so there are some things that you can do to ensure the cleanliness of animals. One is dairy clipping, and especially some of the Swiss breeds can get really long hair that likes to collect debris and dirt. This Saanen doe here, let me put my laser on. You can see this Saanen doe with the amount of hair that's around her mammary system. It's really easy for dirt, debris. You can see there's like some shavings or something stuck to her rear udder. So doing a dairy clip, and sorry for the pictures. I have Nubians, and so these are pictures of Nubians that are dairy clipped. Nubians don't grow very much hair normally, but you can see like this gray doe. This is around freshening time. She's had the hair removed from the backs of her legs and her rear udder, and it will actually extend up into the forudder. This also, in addition to helping keep the udder clean, also stops any lotia or after the products that they continue to pass after kidding for about 3 to 4 weeks in goats. One of the long of all of our mammalian species, they actually pass after birth LOSHA for the longest period of time of any of our domestic species. So it keeps that from caking onto the rear udder. They'll get dermatitis and stuff of the rear udder if you don't keep them clean from that material. So keeping them clean is important, but also their living situation. So keeping them in clean bedding that is free of moisture. They shouldn't be in the mud. They should be up out of the moisture if possible. Whatever bedding type you use, using something that doesn't really collect fecal material in it and then clump or get onto the animal. So I really like straw. I learned when I was in Iowa that a lot of people there are using corn stalks, which it sounds like behave very similarly to straw. One of the things that is important, not so much from a freedom from debris or sediment, but from freedom from mastitis or bacterial infection. If anybody uses wood-based products, so shavings, shavings can predispose towards some bacterial pathogens if they are not kiln dried. So making sure if you are using some sort of shavings, ideally they will be kiln dried before being used as bedding for animals. And then these two things are aimed at keeping, so dairy clipping and clean bedding are aimed at keeping the animal free of debris before they come into the milk parlor. But we all know that sometimes like goats just come in and they have debris on them. So one of the things is removing that organic debris from the udder and legs before you actually start the rest of your milking prep. So that might be using a dry towel or a brush or something if there is excessive organic material on the animal to remove it and try and get her as clean as possible before moving on to milking her. Freedom from off flavors or abnormal color or odor. This is something that there's different things can play into whether you get kind of off flavors in the milk. Nutrition can be really important. I practiced for about 10 years in New Zealand, and there some of our dairy animals will graze on cover crops. One of the most common being turnips or other brassicas. And you actually have to limit the amount of time that animals spend grazing on brassicas, or you get brassica flavored milk. And it actually is pretty obvious if you overfeed them. You can actually smell it coming off of the milk. One of the things that I see a common complaint, I admit that I spend some time on social media just reading what people have to say about their goats and what is happening with their goats. And one of the things that I sometimes see is people asking why their milk tastes salty. And actually, when you have mastitis or infection of the mammary gland, it increases the amount of sodium chloride or salt in the milk. And so mastitic milk often tastes salty, even if it's subclinical mastitis milk that doesn't necessarily have any abnormal appearance. And then you can get bladder infection that will change the color. So if you have severe infection where you have breakdown of the blood-milk barrier, so the blood vessels basically burst and then you get blood into the milk, you'll get red, or if it's old blood, kind of browny colored milk. Infection can change the color to yellow or clear. So these are all things that we don't want in a high quality milk product. And then in terms of off flavors, in particular with goats, handling of the milk post-harvest has a real impact on the quality and flavor of milk. So quick cooling is going to reduce spoilage or souring of the milk. So depending on what your milking system is, if you're lucky enough to be in a commercial dairy that has a cooling plate where the milk is running over a cooling plate and then into a chilled vat, that's great. Some places don't have a cooling plate. They just have a mixed chilled vat. But it's really important that within a certain amount of time that milk gets down to a cool temperature. If you're, making milk for yourself, or if you're a homesteading operation, using either ice baths. I use a ice water bath, particularly in the summer out here in California, where I dunk my glass sealed jars full of milk into ice water. It gets them cooler than sticking them in the freezer or in the refrigerator. Gets them cooler faster. And I think it improves the quality of the milk and the longevity of the milk. The next thing is low in bacterial count. So this is where there are kind of two sources to think about for bacteria ending up in your final milk product. One of those is the environment in which you're milking, and the other is the animal itself. So you want to have clean and disinfected teats. You want to have clean and proper disinfection of your milking equipment, and proper maintenance of your milking equipment, and then mastitis prevention identification. So actually one of the common findings that I've had when I've had dairies that are having, for example, coliform count problems in their milk, is it often isn't the animals. So coliforms are a specific type of bacteria that are common in the environment. It's often problems with their cleaning and disinfection of their milking equipment. So making sure that you're changing out your liners on the recommended cycle. So depending on whether you're using rubber or silicone, your manufacturer that you get them from should tell you how many milkings before they need to be changed out. Changing out hoses. One of the things that a lot of people forget, and I have actually was recently talking to a producer where they were having coliform counts, and in their parlor, they had just never changed out any of the gaskets and any of the joins of their pipeline system. And those were getting old and cracked, and they were acting as a harbor for bacteria. So going through and making sure that you're replacing the parts of your milking equipment that are likely to crack, pit, or create microenvironments where bacteria can grow is really important. Cleaning and disinfection of the teats. Again, we talk about pre-dip, which is supposed to help prevent against environmental pathogens. Remember, if you are pre-dipping, you're wanting to leave that pre-dip on for a minimum of 30 seconds. So if you're milking only a few goats, it's really easy to just dip and wipe, and that's not really doing much for its intended purpose. So dipping and then finding yourself something to do for 30 seconds and then wiping it off. And then mastitis prevention, this really identification is key. So, the strip cup here. So this is a really good way to look for any abnormal milk before it gets to be super abnormal. So this might catch a little tiny bit of garget at the teat end, which is like kind of clotting of the milk or little flakes in the milk. It also lets you assess the color of the milk. So this is a great way to kind of assess whether or not you think the milk is totally normal or not. And then if you do see some garget or a little bit of flaking, then there are some additional things that you can do to help identify what might be going on. And again, milking hygiene and equipment is going to help to prevent equipment cleaning is going to help to prevent mastitis. So it should be free of chemicals. So drug withdrawal periods, this is very important when you're talking about taking a product from your animal and using it for consumption or to make products with it. And one of the challenges that we face in goats is that we have very, very few drugs that are actually labeled for use in goats, which means that the label prescription, and I see this quite often, and actually the NOMS survey from 2019 on goat farms, the vast majority of goat farmers would just use the withdrawal period that's on the label for cattle. So in this case here, this is LA 200 or Oxytet, which is I would say one of the most common antibiotics we see used in goats. And most people were using for milk a 96-hour withhold period. But that's actually not the correct period of time to use. Your veterinarian who prescribes you this drug, especially now that it is prescription only, you can't get this over the counter anymore. They should be giving you a withhold period. And they have resources for veterinarians to help decide what those withhold periods are. But when we as veterinarians decide to use a drug or prescribe you a drug, in what's called an extra label fashion, so to an animal that is not on the label, there is zero tolerance for any sort of detectable levels of that drug. And so it actually has extended withdrawal periods. So in my experience, as an example, the withhold period for LA200 for a lactating doe is about 10 days, as opposed to 96 hours in the cattle. The other thing to think about, if any of you are, say, feeding other livestock your milk, and particularly commonly we see waste milk going to replacements or to feed animals that are intended as meat animals, that when you feed those animals, you're also exposing them to the antibiotic, and often exposing them to subtherapeutic levels of the antibiotic in the milk. Same goes for dewormers. So, one of the things that we worry about in certain parts of the world, well, we worry about it everywhere. It's more relevant to clinical practice at the current moment in some parts of the world is anomenthic resistance. So resistance of parasites, internal parasites to dewormers. Well, if you go feeding your babies milk from does that have been dewormed and are secreting small amounts of that drug in their milk, it also could contribute to parasitic resistance to dewormers. So these are all things to think about when we think about milk quality. We want them to be free of all these things if we're using the product. And it doesn't necessarily mean just using the product for human consumption. We want to make sure that we're removing the teat dip properly. I actually don't know here in New Zealand when I practiced. They actually would measure iodine levels in the milk. And if they exceeded what would be expected, you could actually receive a grade for excessive iodine. And then no chemical residues from your milking equipment. So making sure that you're following the instructions for your detergents, disinfectants, and acids should result in a milking system that then doesn't have any residues from those things go into your milk. Normal composition and acidity. So normal composition, we're talking about butterfat, lactose, protein, what we would expect to be normal for that breed stage of lactation for that animal, and then somatic cell count. So somatic cells are any cells that have a nucleus or DNA. In the mammary gland, during normal, healthy mammary gland function, we have a small number of somatic cells. One that is the neighborhood watch called the macrophage, and their job is to look for pathogens that might be trying to get in and create mastitis, and then to either get rid of them or to alert others that they need to come and help get rid of it. And then we also see, particularly in goat's milk, epithelial cells. So these are cells that either make the milk or line the ducts of the milk gland that will also be shed into the milk. And so those are detected as somatic cells. But when we get mastitis, we get the neighborhood watch cell, the macrophage, calling in another type of cell called the neutrophil, which really fights bacterial infection by trying to gobble up all the bacteria. But those counts get really high really fast when you have either subclinical mastitis or acute mastitis. And so you can see that reflected in the somatic cell count. So if anybody is using DHI testing, you're going to get, every time you do a milk test, you're going to get a somatic cell count. So in this example here, this row here is somatic cell count. And looking through this happens to be cattle, but the same principles apply. If you have goats sitting at, this says 7,352, but this is actually times 10 to the third, so it's times 1,000. So this is actually 7.3 million somatic cells per mil of milk. That is an excessive amount of somatic cells in milk. This would be consistent with having mastitis. There's kind of, for me, with goats, I would consider anything under 750,000 to be relatively normal, something between 750,000 to 1 million to kind of, depending on that goat's normal, her stage of lactation, might be an area for concern. And once we start getting over 1 million, I believe that we have some sort of abnormal inflammatory process going on in the mammary system. We don't have a lot of great data on goat somatic cells. There is some information out there. There is a dogma that goat somatic cell goes up as their production goes down, which I believe is true. But I think we often discount high somatic cells in late lactation goats when those goats still are producing an adequate amount of milk and they shouldn't have a high somatic cell. So I think there's a lot more work to be done in this space. The California mastitis test, if you are not on DHI test, so anybody that milks goats, in my opinion, should have a California mastitis test in their milk barn. It's an animal side test that tests for elevated somatic cell count, and basically it's a reagent that reacts with the cells to make a gel. And the more gel you get, the higher the somatic cell count is. If you are not on DHI test, you can use this very similarly in that once a month, you can actually just CMT your entire herd and look for animals that have gel. If you're going to do this, you need to keep records and you need to look at these animals over time and what they're doing over time if you're going to use it as a screening tool like that. On the other hand, for anybody that's milking goats, literally, if I have a goat that's normally in the first string and she comes in the third string, if she doesn't eat all her grain, if she's slow to walk into the barn, if her ears are droopy, if she, I don't know, looks at me wrong, I CMT her. It's just like, for me, taking a temperature and doing a CMT is the very minimum I do for any animal that is not acting like their normal self. And then I talked about this a bit, but you do see when you start to get mastitis, you see changes in milk composition. And so I talked about wanting to have normal milk protein, normal fat, and normal lactose. These are the things that are going to contribute, particularly if you're making things like cheese, to the quality of your product. And what we see when we get mastitis is we get decrease in casein, which is the major protein responsible for cheese yield. We get decreased calcium, decreased lactose, decreased fat. All the good stuff in milk goes down, and we start to see increase in inflammatory proteins and salt, basically sodium and chloride. So that's kind of the grand overview of milk quality and the importance and what we're looking for when we say we have good milk quality. One of the major contributors to poor milk quality is mastitis. And so what really is mastitis? It's inflammation of the mammary gland, and the most common cause of mastitis is bacterial. And usually if it's a goat or a cow, it's a single gland or lobe that's affected, and ascending infection is the most common route, meaning the bacteria comes up into the teat canal, gets up into the gland cistern, and then eventually makes its way up into the mammary gland and infects the parts of the mammary gland that are making milk. And if they're severely enough affected, they'll actually atrophy and they stop producing milk. Now, we can diagnose this again using somatic cell and the California mastitis test, clinical signs, and then milk culture, actually looking for what bacteria is there. This is a repeat the last slide that I talked about, but somatic cell is really important, particularly when it comes to finding subclinical mastitis, which we'll talk a little bit more detail about. So milk cultures are really essential for the diagnosis of mastitis. If you are seeing cases of mastitis on your farm, really making a good prevention and treatment plan depends on understanding what bacteria you're getting, because how we manage different types of bacteria is very different. You want to be taking a sample, sorry. I need to get, you want to be taking an aseptic sample. So you want to use a technique in which you're not getting environmental contamination into the milk. You want just the milk. And one of the things that I think is really important is that often if we're seeing something that's clinical mastitis, we're going to want to treat it before we're going to get any results back. But that doesn't mean that you shouldn't take a sample before you treat them. So one of the really cool things with milk is that you can take a sample, you can actually freeze it and then culture it later. So if it's a weekend and the lab's not open, if it's too much, like I know in the spring, can get overwhelming, and getting it to a place where it can be cultured might not be feasible. You can just stick it in the freezer and you can culture it later, especially if the animal doesn't respond to your protocol for treating mastitis that you have on your farm. The other interesting thing about freezing it is that depending on what bacteria you're looking for, it can actually improve our recovery rate of some of the bacteria that like to live inside the cells. And that's because the freezing process actually breaks the cells open. So you can improve recovery rates of things like Mycoplasma and Staph aureus. And then many of the mixed dairy practices or mixed practices will perform in-house milk cultures, including Mycoplasma. And we're also starting to see more and more producers that are setting up milk labs on their own farm. So you can actually do cultures to at least get an idea of what pathogens or classes of pathogens you're dealing with right on the farm. If that's something you're interested in doing, I would recommend that you work with your veterinarian to make sure that your setup is a good setup and that you're accurately identifying the bacteria that you're finding. So when we talk about mastitis, we classify it into two different categories. So we have subclinical mastitis and clinical mastitis. Subclinical mastitis is going to basically, the animal is going to appear completely normal. The appearance of the milk is going to be normal. The mammary gland will often palpate normal. And the only thing that you might actually see is an elevated somatic cell or a CMT count. And while we don't often, the loss in production is often not enough for the milker to detect on a day-to-day basis, it is associated with decreased production. And because it's the most common form of mastitis, it actually has the most economic impact on total milk production and profitability of like making milk from animals of either type of mastitis. The most common, so they're gonna have this actually normal looking mammary gland, normal appearance to the milk, but it will be culture positive. One of the challenges with some of the subclinical mastitis is that there is bacteria there, but our ability to culture it, it can be intermittent. So they can be intermittent shedders, particularly with some of the staph and Mycoplasma species. And these can be these persistent infections where they're only shedding it into the milk at certain times of year. And then we have clinical mastitis, which I break down into kind of 3 categories and then the kind of sequela to mastitis. So the 3 categories are peracute, acute, and chronic. And so peracute is the kind of what most people would think of as blue bag mastitis or gangrenous mastitis. Super rapid onset of very severe systemic signs. These animals are sick, they're down, They look like they're in shock. The gland usually has gross pathologic change. And there's breakdown of the blood milk barrier. And so there usually is like bloody or brown appearance to the milk. In acute mastitis, really the animal is not systemically ill. They have a localized infection of the mammary gland, but the mammary gland will often feel warm or hot. It might be swollen. It might be tender to the touch. And the milk often has a gross abnormal appearance. So you might see garget, you might see serous, where it's kind of clear yellow fluid instead of nice white opaque milk. And then you have chronic mastitis. So in goats and sheep, we have one very specific type of chronic mastitis that's viral mastitis caused by CAE. Often you'll hear it referred to as hardbag mastitis, and this is actually a response to a viral infection that results in kind of fibrosis of the mammary gland. And so you'll have these animals, they come in, and if you don't feel the udder, you look at the udder, you actually think that they have a lot of milk and that they're going to be great milkers. But when you go to feel the mammary gland, there's very little milk and it just feels hard, thus the name. And then you can also get chronic mastitis where you get either gross abscessation. So the classic of that would be Corynebacterium pseudotuberculosis, or CL, where you get abscessation. Trupperella pyogenes is another one that will cause like abscesses throughout the mammary gland. But then you also get microabscessation, which is where there's small little abscesses all throughout the mammary gland, but you don't necessarily see those from the outside. And that would be very classic of Staph aureus. And then fibrosis can be a long-term sequela to either clinical or subclinical mastitis. I put it in the clinical category because if you leave subclinical mastitis long enough and it results in fibrosis, you will eventually start to notice that that side of the mammary gland lacks the fullness and plumpness. There'll be a little bit of a change in the texture to the mammary gland if you have chronic subclinical mastitis that is left untreated and that the animal doesn't clear. So again, clinical versus subclinical, you're looking for the presence or absence of clinical signs. One of the things I think comes back to the kind of economics of mastitis is that really the ones where you cull them, you have to, or they die, that's the tip of the iceberg. And then you're going to have treatment of clinical mastitis, where you're going to have to discard milk because of treatment and because the milk is abnormal. But really, in the grand scheme of things, those costs from mastitis are nothing compared to the costs from subclinical mastitis. So subclinical mastitis, and this is based on cattle, but I believe that it's similar in goats, is that in this scheme, 70% of your reduced milk production in your entire herd is actually due to subclinical and not clinical mastitis. So this is a really good example of how you might use your somatic cell count, or DHI, or if you were doing serial CMTs and keeping track to identify problems within a herd. So this is a seed stock client that I have that is on DHI test, and she pays very close attention to her somatic cell counts. And so I can tell you, I started getting phone calls here and I started getting phone calls here. And what you can see is these goats had absolutely no clinical signs. There was not a noticeable reduction in their milk production. Again, they probably had reduced production, but not something that the person milking them could, tell just by milk weights without looking at them over a long period of time trends. But you can see here the dashed line is their average herd somatic cell, and then the solid lines are individual animals. So around this time here, this was actually interesting. This, I believe, was a tail end lactation, very low production. These two does, I think, on their milk test were under 6 pounds of milk probably around 4 pounds of milk. And these are standard sized dairy goats. So, and they were, due to be dried off any day. And so this, I do believe could be, but these could be just due to low production, but we cultured these 2 does, and one did culture a environmental staph, so she was treated. But this out here is more concerning to me. We're starting to see jumping around of somatic cell in recently fresh does. So we're talking peak lactation, and our herd somatic cell is creeping up towards 1,000 or 1,000,000, I should say. And so at this point, what we did was we did some cultures, and we were having some environmental staph issues. So we just reassessed her milking protocol, her milking machine hygiene, and treated some of these does, and then we were able to get her somatic cells back down. But just remember that with subclinical mastitis, you're going to have production losses. But you also, so you have reduced milk yield, but you also have reduced curd yield, and you have longer coagulation time. So with so much of goat milk going to cheese production, this really has a negative impact across not just losing milk, total milk, but you're also losing the amount of cheese that is made from that milk, and the process for making the cheese can actually be altered by having mastitis. So again, clinical mastitis, these per acute cases, you can see here, this picture is a little dark, it's hard to see, but this half of the mammary gland is actually cold and purple, and what's coming out of it. So this is the affected half, and this is the normal half. And they're often sick, depressed, don't want to get up. The most common pathogens in goats is Staph aureus, coliforms, Bacillus cereus, and then Mannheimia hemolytica. I've seen a few of these in goats. I've hardly ever seen it in cattle, but it's actually quite common in sheep. And then acute mastitis, where they're not systemically ill, but they have an abnormal gland and the milk is grossly abnormal. So these are some variations of things that you might see. And then again, our chronic mastitis, this is a ewe with hard bag mastitis. And then this is a doe with Corynebacterium abscesses in her mammary system. So what are the major bacterial pathogens that cause mastitis? So we categorize them into 2 different categories: environmental and contagious mastitis. Environmental are opportunists that infect the mammary gland from environmental sources, whether that be the milking machine, poor hygiene in the pens where they're kept. Those are all potentially going to contribute to environmental sources of opportunistic bacteria. So for prevention, milking hygiene, again, pre-dipping and clean housing and bedding is important. For surveilling for these environmental pathogens, bulk tank CFU. So if you're in a commercial dairy, you're going to be testing the amount of bacteria that's growing in your bulk tank, and coliform count too, in particular. If you are looking at the amount of coliforms that are growing out of your bulk tank, if you have a high coliform count, then you likely have some potentially either contamination of your milking equipment, but you could also have environmental mastitis. But looking for things like excessive staph on your bulk tank. Milker assessment. So again, this is milkers paying attention to mammary glands when they're milking them. CMT and DHI somatic cell count, and then for stripping. So checking the milk before you attach machines. And then the contagious ones, we have Strep A galactea. I rarely see this pathogen in goats. I find staphs are much more common than streps in goats as compared to cattle. But if you do find Strep A galactea in a goat, it is contagious from one animal to the next. The big ones, the 2 really, really important ones that we deal with in goats are Staph aureus and Mycoplasma. Mycoplasmas are host species specific to some extent, although you can, they will transmit, say, from sheep, from goats to cattle and cattle to goats, but they have kind of host adapted strains. These spread from animal to animal during milking by fomites, and these all have the potential to have a carrier state with subclinical infection. Prevention is milking hygiene, so post-dipping, and the reason post-dipping is important is you get milk residue from the machines left on the teats, which can contain milk from that animal as well as other animals that have been milked on the line. Milking machine maintenance, ensuring that your milking machine vacuum is working properly and that you're not getting liner slippage, which can result in milk from the pipeline going back up to the teats. Pasteurization of milk for the young. So if you're feeding milk from the does to your babies, particularly for mycoplasma mastitis, is pasteurizing the milk, and then keeping a mastitis string or culling these animals, depending on the herd situation. And again, if you're finding Staph aureus in your bulk tank, then you have Staph aureus animals somewhere in your herd. You can do herd culture for these, so whole herd culture, and then monthly somatic cells are also going to help.
Fauna, there's a question in the chat box about just how important are gloves on milkers' hands as you're dealing with this milk.
So this is my 2 cents on gloves. Gloves are the ideal way to milk animals if you still treat the gloves like they can get dirty. So gloves are not a barrier against bacteria. Gloves are trying to protect. We have bacteria. We have crevices and cracks on our hands. If anybody that works on a farm, they've got dirt under their nails, they've got cracks on their hands. Like, we are a potential place for bacteria to like hide, and then we can transfer the bacteria. So wearing gloves gives us a smooth surface, but we need to keep it clean. And one of the biggest mistakes that I see, or one of the things I see when I walk into milk parlors, is people treating gloves like it puts an impermeable sheath on their hand. And so they will have like manure and milk on their hands, but because they're wearing gloves, they don't clean them. So you still need, wearing gloves is important, but you still need to keep your hands clean. And if you are not doing that, and if you're going to keep your hands cleaner, if you aren't wearing gloves, then it might be worthwhile just making sure you wash your hands between every animal, or, you know, have some sort of hand disinfectant around. If gloves make you feel like your hands are invincible and no longer can get bacteria on them, if that makes sense.
Yeah, and so Fauna, maybe a second question, then dealing with Staph aureus. So I'm kind of thinking from the dairy cow world, how it gets into the udder, especially as the cows age, and it might shed like monthly or whatever. So sometimes when you're doing a culture, it might not show up,
Right.
but it might just really, is it the exact same thing in goats?
Yes, so it can be exactly the same thing in goats. So one of the things is in animals with chronic high somatic cells, that especially if you have known Staph aureus in your herd, serially culturing that animal, not just taking a one-off negative culture and saying, oh, yep, she's negative, but is to serially culture them, and then culture them at higher stress times of year. So culturing at kidding is also might enhance your recovery rate, or at dry off, one of those 2 times. So pre-dry off cultures can be very useful too. So kind of getting into some of the weeds of the specific pathogens, coag negative Staphylococcus is responsible for about 85% of cases of mastitis. It's a gram-positive bacteria, so this is environmental staph. They're skin contaminant. Well, they're not really skin contaminants. They are normal bacteria that live on the skin, and then they can get from the skin up into the mammary gland. They are major cause of subclinical mastitis, so they can also cause clinical mastitis, and they can result in really high somatic cell. They do tend to be responsive to treatment if they're treated early. And I do think there's more work needs to be done on how coag negative staphs behave in small ruminants, particularly goats. I feel like we see a lot of either reoccurrence or reinfection after treatment. And so I think more work needs to be done in the space of CNS control in goats, and not just assuming that it behaves exactly as it does in cattle. And if these go unresolved, you can end up with mammary fibrosis. Coliforms, again, these are environmental bacteria typically associated with fecal contamination, or pastorellas, which is Mannheimia hemolytica would be the most common one in goats and sheep. Those actually are normal commensals of the oral cavity and the oropharynx. And so potentially if you have, if you're doing milk sharing where you have kids nursing does and then you're milking from them, this might be a pathogen you might be more likely to see. Pseudomonas and Klebsiella, also two really nasty coliforms that cause gangrenous mastitis. So this is really important, is keeping a clean, dry environment. And then after milking, one of the things that I think is really important is having fresh water and new feed for them when they go back to the barn after milking. It keeps them standing and up and out of the environment where there's fecal material while their sphincter is closing and they're redeveloping a little bit of a keratin plug. And so if we can keep them standing for about 30 minutes after milking, that would be ideal. And then udder hygiene and milk handling is important. There are vaccinations for cattle, and I have seen goat producers using these off-label. I have not had a herd situation yet where I have addressing the management if they have a coliform problem hasn't fixed it. So I have not had a lot of experience using these. I do know from the people that have used them is that goats do have a pretty often have a pretty severe reaction. They're likely to get fevers and feel not very well after getting the vaccination. Bacillus cereus, this is another cause of gangrenous mastitis. It's a gram-positive. I put this one in here because for a long time when we would get this on a milk culture, it would just be considered to be a contaminant. And I think if you're seeing it growing with other pathogens, it is a soil environmental bacteria. So if you're not clean in how you take your milk cultures, you could definitely end up with this as a contaminant. But we now have a lot of evidence to suggest that this also is a cause of environmental mastitis, very severe gangrenous environmental mastitis, where we get pure cultures of this from animals with clinical disease. So it's one to keep an eye out for, especially if you're dealing with clinical cases. Staph aureus. Now this bacteria is just, if you get this in your herd, it can become a real problem. And it's a gram-positive bacteria. It is a contagious bacteria. And it's the most common cause of gangrenous mastitis in goats, but it can do whatever it wants. So we see the entire gamut of presentations of mastitis from Staph aureus. You can have subclinical, where the only thing that you can detect on that animal is that they have a chronically elevated somatic cell. You can have the chronic microabscessation of the mammary gland. You can have acute, or you can have acute gangrenous forms of mastitis from this bacteria. Treatment is really pretty much ineffective. Really the best thing to do with these animals is cull. I deal with a lot of seed stock producers, and in general, my advice to them is if the animal is of really important genetic merit is to mastectomize them if you want to keep them. I do have dairy herds where we have too many animals to just cull. So then we create strings of Staph aureus positive animals. We regularly test animals and move them into the staph string, and we milk them last, and then we dry treat them. It is your best chance at cure is in the dry period, but it's still low compared to treatment of other bacterial pathogens. don't rely on a single negative culture for cure. So even if you do treat them and then you retest them and you get a negative culture, I would not believe that without multiple cultures over time. There is a vaccine available, and I would consider this a vaccine for herd recovery, and that's how I've used it when you're talking about Staph aureus. And what you're wanting to do is you basically want to treat your replacements right before they kid for the first time. So you're treating yearlings or first freshening 2-year-olds 30 and 60 days prior to kidding, as trying to keep them from becoming infected. If you went through and treated a herd that has Staph aureus, if you went through and treated the entire herd, you could actually see a rise in your somatic cell counts without clearing the bacteria. So subclinical carriers will actually have an immune response that doesn't clear the bacteria, but does create higher somatic cell. Mycoplasma mastitis. So this, the big contagious one that we really worry about in goats is Mycoplasma mycoides subspecies capri. It used to be called as Mycoides, Mycoplasma mycoides, subspecies mycoides large colony. So if you see that around, they're the same thing. There are also other mycoplasmas that we do see causing mastitis in goats. Putrefactions can act a little bit like Mycoplasma capri, mycoides capri. But this really is the one that we're wanting to watch out for. Classically, the milk might look normal, but if you leave it to sit, you'll see a kind of a cellular or granular sediment. Kids are infected if they drink milk from infected does that is not pasteurized. And there is no effective treatment for this. And this one really is, you need a control program, and you need to cull affected animals. So you want to culture and identify. The other challenge is that this is intermittently shed. Culturing of colostrum is actually the most sensitive in terms of getting a positive culture result. But the other thing is that if you are doing cultures for mycoplasma and you get mycoplasma back, I strongly encourage you to either as veterinarians or working with your veterinarian to send it off for speciation. You want to know which of these mycoplasmas you're dealing with, because how you manage your herd from that diagnosis can be different, but depending on who you are identifying which mycoplasma. So speciation of the mycoplasma is important. And then remember, this requires special culture. It doesn't grow on the same plates as everybody else. So if you're doing on-farm culture, you're not going to be detecting mycoplasma. Most of the diagnostic labs in each state do have reasonably priced milk cultures that include mycoplasma. I think when I was in Iowa, it was $10 for a blood auger and a mycoplasma culture. And out here in California, it's about $9.50 for both. The control measures to stop it spreading through the herd, because remember, you're not just going to spread this from goat to goat, but you're also going to spread it like through milking procedure. You're also going to spread it from moms to babies in raw milk or colostrum. So this is where heat treatment of colostrum, and then I should have added here pasteurization of milk. In the 1960s, the very first programs for heat treatment and pasteurization were actually aimed at mycoplasma before we even knew what CAE was. And I think a lot of producers now think that the reason that we do these programs is for CAE prevention. I would much rather have to deal with CAE than mycoplasma in my herd. So it really is an effective control measure for stopping vertical transmission from moms to babies. You can culture the ear canal of herd additions. I think again, this is you deciding what diagnostics you want to do should be based on herd risk. And then CAE mastitis, again, this is the kind of hard bag mastitis. often you'll see swollen knees, and again, heat treatment of colostrum or pasteurization of milk. I have a few minutes left, and I'm just going to quickly go through some data that we have gathered here at Davis, looking at clinical cases of mastitis that we see in the hospital here. We did a study looking, basically going back through our medical records, and we also have a microbiology database here where we can pull all the isolates and their antimicrobial sensitivity. And so we did that for a 10-year period from 2012 to 2022, and looked at isolates from small ruminant milk cultures. And in our study, we had 74 goats and 10 sheep, and we evaluated their kind of clinical history, as well as classified them into what type of mastitis they had. And so we wanted to identify their, breed, age, production use, and stage of lactation in which we were seeing mastitis being diagnosed, and then to classify them into the different types of mastitis, and then correlate that with the bacterial isolates, and then look at their antimicrobial sensitivity. So animal purpose, not surprisingly, dairy goats were the most commonly presenting animals. And it's, we don't really know 100% why that is. I think there are two contributing factors. One, dairy goats tend to be milked and somebody is touching and looking and feeling their udder 1 to 2 times a day in general. So they're more likely to catch mastitis. The other consideration is these are also animals that are being milked by human beings with, milking equipment or human hands. And so, we know that hygiene in those situations can contribute to the development of mastitis. When we looked by lactation stage in the dairy goat, it was predominantly identified in lactating animals, and very few in the dry period. Whereas with the other animals, it actually seemed to be equal or more in the dry period that people noticed that there was mastitis. And then clinical presentation. Again, this is a hospital, so these are animals that are presenting to us because they have a medical issue. So in this case, 43% of the animals presented for having acute mastitis, 30% for peracute, so that gangrenous mastitis, about 13% or actually 15% for chronic. The acute on chronic were acute cases of mastitis on top of animals with hard bag mastitis from CAE. And then the subclinicals were animals that were diagnosed off of CMT, and they were presenting for some other problem in the hospital. So they might come in for pneumonia, and as part of a physical exam, if they were a dairy animal or a lactating animal, they would have a CMT performed. So for our acute mastitis, so remember acute mastitis, these are animals where the mammary gland is affected, but the animal is otherwise healthy. The most common kind of things we found on culture was either no organism or coag-negative staph. So the outer ring here is the first pathogen that was isolated, and then the inner ring is where there might have been more than one pathogen identified. So of our 21 cases, or 21% coag-negative staph, 14.29% were just that, and then the other few cases had some other bacteria growing with them. The no culture, I think, was more common in this group because many of these animals had been treated by their owners before they'd presented and had failed to respond to treatment. But again, you can see that staphs are the most common cause of acute mastitis in our population, with CNS and Staph aureus, but also Mycoplasma is still sitting here. So we are still seeing quite a few cases of Mycoplasma. And then for the peracute, which is the gangrenous mastitis, again, Staph aureus is the most common in our population. Pseudomonas aeruginosa was the second most common. And this is doe, you can actually see this line of demarcation. This was the color of her milk. She was a Pseudomonas aeruginosa case. So this was really interesting. So antimicrobial sensitivity, when we looked at our staph species, so there's two ways that we can look at whether or not they're sensitive to antibiotics. One is by trying to grow them on a plate where there is antibiotic. And so at different concentrations. And so what we found was that in the CNSs in our population, 7% of them were resistant to tetracycline. So that would be the same family as oxytetracycline or LA200 biomycin. And about 2.3% of them were resistant to Naxel or Ceftiofur, which the brand name that most of you would recognize would be Naxel. But even the bacteria that appeared to be sensitive on these special plates, where we look at them growing in the face of antibiotics, the other test that we do on our isolates here is to test them for whether or not they produce an enzyme called beta-lactamase. And this enzyme actually deactivates the beta-lactam antibiotics, which includes penicillin and Naxel. And so we were quite surprised at the percentage of our isolates that were producing beta-lactamase. And then for Bacillus and E. coli, which are two major causes of gangrenous mastitis, we saw multi-drug resistance. So resistance to a whole bunch of different antimicrobials. With Bacillus, we did see that most cases were sensitive to fluorphenicol or to tylosin. One of the things, if you're dealing with dairy animals, fluorphenicol has about a 70-day milk withhold in the goat, so it's not really a drug that should be being used in lactating animals. Tylosin has a more reasonable withhold period and would be something you could reasonably use in a lactating herd. E. coli, Ceftiofur, so Naxel, though Naxel does not penetrate into the mammary gland very well, they were all sensitive to this. So it would be predicted that they should be sensitive to intramammary Ceftiofur, which is Spectromast, is the brand name for our intramammary Ceftiofur. But remember, again, that's extra label use in the goat, so an extended withdrawal period would apply. And then this is the one, our second most common cause of gangrenous mastitis is Pseudomonas aeruginosa. And this one is bad, really, really bad. And all our isolates were resistant to basically any drug that is legal or appropriate for use in small ruminants. So the only things that it was sensitive to are either illegal or inappropriate due to such extended withdrawal periods that we didn't really have an appropriate drug to treat these guys with, which is, something that we don't want to have to think about. So again, our conclusions, the most common signalment is lactating regularly milked dairy goat. Non-dairy goats were equally likely to present in the dry period as during lactation. And then our most common clinical pathogens associated with our different clinical presentations. So acute was coag-negative Staph aureus, and mycoplasma. And then for the peracute was Staph aureus and Pseudomonas. And again, 20% of our staffs were expressing beta-lactamase, and we did see some tetracycline resistance. Bacillus, fluorphenicol, or tylosin would be the most effective treatment. E. coli, intramammary Ceftiofur should be effective. And then Pseudomonas aeruginosa, there was no sensitivity to any drug appropriate for use in small ruminants. What I will say about this data is that this is based on what we know in cattle and humans, and we don't really have any good cut points. So like levels telling us that this will be effective in the goat. So again, this would be types of things to discuss with your veterinarian for protocols, and knowing what bacteria you actually have on your farm, and discussing what are the most likely causes of mastitis on your particular farm, and so what treatment protocols should you have in place. So we want to do further evaluation of the clinical diagnostics and correlating. We actually have histopathologic changes on the animals that unfortunately did not make it, particularly from the per acute cases. So we want to correlate pathogens with the pathology findings. And then we also are going to start looking at antimicrobial genes in these clinical isolates of mastitis and assess the management practices that aid in the prevention. And then one of my goals is to do some looking at Staph aureus for virulence and sequencing. What I want to understand why some Staph aureus cause subclinical mastitis, but in goats, we seem to have these ones that turn very virulent and cause very severe disease. And, you know, what is the difference between those that are subclinical and those that are causing horrible mastitis?
So there's a comment in there about the Vimco, that mastitis vaccine. I want to make sure people saw that. And then there's one question in there about prototheca mastitis. Is that a problem in goats? You want to mention that quickly?
Okay. Well, so yeah, I didn't say the specific name of the vaccine, but the Vimco mastitis vaccine is it is approved for use in goats, which is great because we don't get that very often. So it's USDA approved for goats, and it targets, so the label in the United States is actually only for Staph aureus. However, in other places in the world where this vaccine has a label, it's also labeled for coag negative staph. I have used it for both of those pathogens here. My approach is very different depending on what pathogen you're dealing with. So for the Staph aureus, if you were dealing with Staph aureus, again, it's about herd recovery and trying to keep your replacements from getting it. For CNS, I actually will do whole herd treatment regardless of lactation, lactation number. So basically all lactating does, all does that are going to lactate in a season will get vaccinated prior to kidding. And then prototheca. So prototheca is a blue-green algae environmental cause of mastitis. And I have personally never seen a case in goats. We see it in cattle. It's rare. I would say that it, again, not treatable, high genetic value, just a mastectomy, otherwise cull them.
So that's all the questions that were in the chat box. Does anybody else have any other questions? Oops.
If nobody else has any questions, I could let me share my screen again, and I have a kind of a cool, very sad but cool clinical case.
Yeah.
So this last spring, I dealt with a catastrophic outbreak of Staphylococcus aureus in a dairy herd. So again, we kind of talked about these things, but the economic losses from decreased quality of milk and quantity of milk and treatment, and then you have per acute cases where you have death losses. So in this, this is a mammary gland cut in half. You can see there's some maybe pink normal tissue here. Can you see that? So some pink, and then you have this line of demarcation, and this is basically all dead or dying mammary gland. But these animals also were systemically ill. So this here is a kidney out of which we also cultured Staph aureus, and these are actually infarcts or dead tissue within the kidney that's been killed by causing microclots and blockage of the blood vessels in the kidney from the bacteria and the inflammatory response. So we had a grade B artisanal cheese making dairy, and they, over this course of this outbreak of Staph aureus, they experienced 30% mortality, where we had to either euthanize or animals died from acute gangrenous mastitis. In the end, we ended up, of the 67 that were left alive, we ended up culling 34% of those were either sold or euthanized for chronic mastitis or abnormal milk. And then we were able to use CMT to aid in early identification of cases and get them moved early out of the milk string into the hospital pen. And really the cause of this outbreak was poor milking procedure. So yes, they had Staph aureus in their animals, but they spread it from animal to animal to animal like wildfire. And this was due to they had old inflations, lots of squawking, so milk air pulling into the inflations. They had too low a vacuum pressure, so milk was running out of the inflations when they were removed from the animals. You can see here on this is where they were milking on, and there's like just pooling milk everywhere. Their does are milked once a day and they have incredible milk letdown. So the other issue is that animals are streaming milk as soon as they come into the milk parlor. So there was basically milk all over the milk parlor. So you can see milk just kind of everywhere. You can see here these inflations that the opening is actually deformed and they're quite old. They had not been replaced in a long time. The interventions we put in place, so we changed their milking procedure. They were stripping, so they were opening the orifice and then they were using a return dip cup, so this type of dip cup. So they were getting milk in here. All of the liquid was getting contaminated and they were dipping that from goat to goat to goat. So we changed them to a no return dip cup. So if they got milk, if they saw that there was milk ended up in there, they could actually dump this out, clean it, and then have new teat dip come up. We changed them from, they were using an old claw system that's actually intended for use with rubber inflations because the memory of the rubber inflations is low. So they hang down and they stop the vacuum until you pop them up. They were using silicone inflations on a claw that was intended for rubber inflations. And they were having lots of air leakage and vacuum on while the animals vacuum being pulled into the inflations while other animals were on the milking line. So this here is a pop-off valve we changed them to. So if anything pulls too much air into here, so if you get a squawk, it automatically shut off to stop milk, stop them from squawking on the line. We fixed their vacuum problem. So we capped the old vacuum line, which was not properly capped and was sucking air. And we tried to get their vacuum up to 13 to 14 inches of mercury at the pulsator, which would result in 11 to 12 at the teat end. It was at 9 when we started working with them. We did vaccinate the yearlings prior to kidding for the Vimco vaccine, and then we created different herds. So we did use whole herd milk culture, multiple. The yearlings were milked first. The culture negative or staph species were milked next, and then the Staph aureus and subclinical Staph aureus positive animals were moved in with the clinical animals, and all those animals were milked last. And then we utilized daily CMT to identify new potential cases. So this here is the initial cultures. So this was the hospital pen, and we again did serial cultures of these animals. And what we found, so on the first culture is the outside and the inside is the second culture. So we had animals that were clinical but not actually culture positive. And then on a subsequent culture, they were culture positive for Staph aureus, which is the red. In the main, so this is in the herd that the animals that looked normal at the time. This was on the day that we arrived. They had already lost a lot of animals at this point. We actually identified about 15% of the clinically normal animals that had Staph aureus. So we actually moved those in to the Staph aureus positive string. And then we cultured the yearlings as they kidded, and none of them ever cultured positive for Staph aureus. This here is their CMTs over time, and you can see the animals that had no growth, their CMTs remained normal over the 2 or 3 week period. I think this is a 2-week period where we were monitoring these animals. And then your clinical Staph aureus were obviously off the chart, and your staph species, which I think is interesting because the animals these staph species animals were treated during this period of time, and we actually see as we get out to the end of treatment that their somatic cells are going down, whereas the subclinical Staph aureus goats, their somatic cells remained high. So our takeaway from this was that obviously it can be devastating economically in lactating dairy goats. Culling is the best practice, but it might not be embraced by producers, particularly seed stock and show herds. And milking hygiene really is the key. And antimicrobial therapy is unrewarding.
So I appreciate all the information that you provided, a lot of good information on milk quality that I think people can take back and apply to their farms here today. So we're going to wrap it up. And again, thank you, and hope everybody has a good holiday season.
Thanks, everybody.